Hello.
Wow, that's a nice shirt.
I knew you were going to like it.
That is a wow. Is that exactly a wow moment? You look very handsome with white.
Hey,
With
thank you.
glowing skin.
Thank you very much. You too. I see you are in white too.
No, I did it on purpose.
So it's because I have my, see?
I see.
Yeah. You gave it to me some time ago.
Now, there are people from South Africa watching you. And Lars, I think Lars is from what flag is that, Lars? Sweden? And Kat is from France. I think everybody loves you. And there's a Mr. Garcia. Huh?
Lars is from Norway.
Oh, no, Lars is from Norway. And Austunia is from Miami. So we have a lot of people from all over the world. Okay. Okay, sorry, not. Right now it's 11 o'clock. It's our Sunday share time with all of you. 11 a.m. in Pacific Standard Time. We do have recording the video so you can watch later in case you're not available at this time because most of people are family time. Now, if you're on Facebook or you're on Zoom, please let me know where you're from so I can share with Dr. Alfaro so he knows that we are chatting about life journey of learning balance method and how this will help him and to be a fun process for all of you because this is the family of the balance method. It's a community. I want every one of you to be part of this. I'm gonna starting from those people who learn from Dr. Tan and later on for the youngest member of the balance method acupuncture. For those of you who have not met these people on my interview list, if you have a chance to come to San Diego, please come to San Diego because I'm going to make all these big brothers and big sisters come to San Diego. You can meet with them and whatever question that you guys have, you have people to ask, you get closer because the more we get together, the better we will learn for the acupuncture, especially for the balance method. So if you are from somewhere else, please just say hi. I have Ollie from Finland, Netherlands from Simon from Netherlands, and Hiroko, I don't know where you go from, but I have somebody from India. Right now, I have Dr. Antonio Alfaro here. Hi.
Hello.
Say hi to everybody.
Hi to everybody.
All right.
Thanks for watching.
I can see you have a very handsome shirt on. It was the Academy.
Yeah, the Academy of Acupuncture gave it to me some time ago.
Wonderful, wonderful. So I'm so excited that we're here. And let me introduce you, Dr. Antonio Alfaro. Being a unique perspective to our teaching faculty, Dr. Alfaro specializing in the traditional Chinese veterinarian medicine in San Jose, Costa Rica. Dr. Alfaro has attending numerous levels of accreditation in Dr. Richard Tefutan's Balance Method Acupuncture seminars. Studied with the master since 2003. In addition to presenting countless national and international seminars, Antonio has relentlessly continued his study, strive to provide excellence in the traditional Chinese veterinarian medicine. A retired professor at the School of Veterinarian Medicine at UNA, Costa Rica in 2005, Dr. Alfaro received his certified veterinarian acupuncturist degree at the Bosta Chi Institute of the Chinese Veterinarian Medicine in Gainesville, Florida in 2004, and also Costa Rican Association of the Veterinarian in 2006. Furthermore, at the 2012, Dr. Alfaro received the silver level certification from Dr. Richard Tefutan, and we had a party in Vegas Dr. Tan's 60 years old birthday party. He awarded with the certificate. He also certified with the Academy of Acupuncture with the executive level of the Balance Method Practitioner. Let's welcome Dr. Alfaro. Yay!
Thank you. Thank you. So happy to be here and, hopefully share with the people that are joining us a little bit of the experience that we have as a veterinarian practicing the balance method.
I'm sure I know this, and you are the first one to introduce the balance method acupuncture as a course to the veterinarians, the complete courses, because I do know Dr. Tan frequently as a speaker for the veterinarian seminars. Do you mind if you can share that experience that you went to the seminar that you saw Dr. Tan?
Sure. That was in 2003, and actually was in Brazil, in Santos. I was there for a veterinary association of acupuncturists. Brazil is quite advanced in veterinary acupuncture. And I was going to be presenting something related to thermography, but in another place there in Brazil. So I knew about this, so I went to the seminar, and somebody told me, don't miss this Dr. Richard Tan talk about his acupuncture 1, 2, 3. So, oh, okay, well, let's go and sit and find out what's all about. And of course, he after that, then he wrote somewhere. Well, you can find me in www.drtanshow.com. You know,
Yeah.
so that's after that I start after this seminar. I said, "Oh my God! Well, this is absolutely amazing." And he said, "This is a show because I'm gonna show you right now why it is a show." So he called a whole bunch of people up on the stage, and he started, saying, "Well, what's your problem?" And then he started putting needles in everybody that was in there, and everybody was so uh, surprised. And I said, well, no, this is exactly what I would like to learn. I was in my beginnings with the Chi Institute. I already had, I think, like 2 advanced courses, even though I was not a certified acupuncturist. And then I said, well, no, I have to certify myself as a veterinary acupuncturist and follow Dr. Tan. And since then, um, I did both at the same time. And and I said, well, let's start trying to see if the balance method has any application in animals. And so since then, we start using the balance method in animals and found out so great results. And basically, after I finished with the National University, and the last 4 cases that I had sent there for surgery, I start poking them, with the balance method. And I didn't have to do surgery. They were like big impactions and a lot of, a little semi flexion type of things. So they were not too badly into surgery, but they didn't require surgery. So I
Ah,
said, well, once I am going out of here, I'm going to keep on just basically doing acupuncture. I don't want any more midnight calls or weekend calls or going there and then coming back here. Dog, come back here because the horse, his nasal tube is out. Please come back here and help us and blah, blah, blah. I said, I don't want any more emergencies. And so from there on, I start uh, practicing the balance method quite a bit more into the musculoskeletal system, but also for internal disorders. And so that's part of the story how I met him. And of course, uh, we went in 2012 because I did all the basic track and the advanced track and the essentials for BASI, which I haven't finish. I eventually will. And that's when I had to send, I think, a few cases or something like that, explaining them to him, and then he gave me the silver level certification at his 60 years old party, which was amazing, amazing. And I have that here
Oh,
uh, a
yes.
lot. Yes.
Yes.
So after that, you know, I invited him to Costa Rica. He came here in 2013, and we have a seminar during that time. And then he was only 2 years older than me. And then, so when I was my 60th birthday, I asked him if he would accompany me. And he said, well, sure, sure. You want a seminar too? Yes, let's do a seminar. So he came for my 60th birthday, and we have a great, great, great time. And actually, that was the first time that he reviewed, and the privilege of honor of having him review one of my papers that I presented in Taiwan, and it was the balance method for five sense organs and in animals. And he reviewed it. I have to, of course, you know, when you review a paper, everything is red, and so you have to change a whole bunch of things. But finally, he approved it, and I was able to present that. And that opened up a little bit more the door for the Chi Institute, which is now a Chi University, to accept the balance method as an advanced course. Right now, the balance method is part of the Chi University, and we are very happy and very proud of that. Since 2000, we started that in 2018, 19 with them.
Thank
Yeah.
you for your hard work to make that happen.
Yes, yes.
Because of your connections, that balance method can flourish in the veterinarian balance method acupuncture world. That is really, really wonderful. Thank you for doing so. I'm very proud of you to be part of that. I remember a very long time ago, and I think that was 2003. I was not even an acupuncturist yet. And I remember that I booked in the hotel for you for every other seminars, and you just give me a call, says, Eileen, I need to come to Dr. Tan's seminar. Will you book me a hotel? Then I know how when to fly in and all that stuff. I did
Yes.
it because I was selling needles, right? I need some clients. so, so
That was good.
I was really
Thank you.
admiring that you've been following Dr. Tan for so many seminars because I see you every time there. I was selling
Yeah.
needles. You were in the class. That's how I get
No, no.
to know you very well. And thank
Yeah.
you so much. Other than that, we also had together for the medical mission in Costa Rica.
Yep, yep. I have some little bit of some picture there eventually. If you wanna me to share 'em, I'll be happy to share and talk a
And
little bit about what we also have done in terms of you know, the animals and some videos of some cases that we have used the balance method in conjunction with Alicia. Remember Alicia Lopez? She has done a lot of work with the balance method too. She attended several seminars, and actually, I was looking at some of my notes here, and I found out that you know, when you use like the Yuan and the Luos points, um, actually the Yuan and the Shu string points, you can decrease the uric acid. And I remember, oh, gout. So I remember the first time that we were in Orlando. So it was Dr. Naranjo. You remember Dr. Naranjo and Alicia and myself, and my big toe was like this big, you know, and I could hardly walk. And then he said, Dr. Tassen, well, who wants to be treated? So Alicia got my hand and said, here, here. I said, what? So I went in front of everybody, and Dr. Tan started saying, oh, gout, too much beer, no wine, no red
I think you
meat,
were drinking. I think you were drinking the moonshine from Jim Westmoreland.
something like that. And he put like 17 needles
Oh my God.
and 17 needles in my thumb. Uh, opposite side. And then he said, well, stand up. And then say, okay, well, stand up. And I immediately I felt quite at relief. And then after he said all the bad things about my bad feeding habits and stuff like that, he at the end of the seminar he said, Tony, what are you doing? Well, wherever you want, what you want to do. Come on, let's go to happy hour.
So, so you think is your gout flare up after you're drinking your scotch?
No, it got. Yeah, I treated myself next day and next day, and during the seminar. By the time we went back, we were coming back. I was able to walk pretty good.
Wonderful.
Nowadays we know with the statistical significance that you use the Shu stream point and the Yuan source point, you can decrease the level of the uric acid. So anytime, I haven't had it for quite a long time now, but so I basically use the loan 7 and also pericardium 9,
That's not true. This is Jing.
pericardium 7, yeah,
7.
yeah, pericardium 7, to treat because of the toe, basically liver and spleen. So
That's
that
great.
was something very funny with Dr. Tan.
That's very wonderful. So tell us a little bit about how to identify, you know, when you were telling me the horse is standing on their middle finger and there's only one digital from the human being, we have 10. So tell us how to identify the animals that
Oh, well, we started, remember, we started like saying, okay, well, the cat is pretty much similar to us in terms of where the meridians are,
the cats.
the cat.
Okay.
And then the horse is basically like this. So we have to adjust a little bit. And then you have like
The
some of
dog.
the the dog is like this.
Okay.
Okay? And then you have like the avians, right?
The birds.
And then you have the cow,
The cow, two
right?
fingers.
Right? And then you have the dog. I mean the
Horse.
horse.
The horse.
Okay. So the
So the
horse
horse
has,
is always on the tip of their fingers.
yeah,
Guardian 9.
on the nasty finger all the time. Yeah.
And then
So that's why we have to adjust a little bit. You know, we have to adjust. But the horse, contrary to the rest of the animals, the horse, the camels, the goats, and the cows, they they have acupuncture points since 600 years before our common era,
oh.
while the dog is more transposition from the humans because
Mm.
it's more recent time. Okay. So actually, Dr. Shea was saying that dogs about 200 years our time. But so this is unbalanced method in animals. Basically, yes. I think not myself, but Jean-Yves Gouret probably is the first veterinarian to use the balance method, and then I follow, and Dr. Bruce Ferguson also, and then after that, um, we start with the Chi Institute, and now right now we have about 58 students from about 16 countries, and last year, and we have about 35 veterinarians already certified on the veterinary balance method by the Chi Institute. So
That's
it's,
wonderful.
yeah, we want to keep on doing. That's my mission that I promised Dr. Tan that I was gonna try to follow his path, at least by sharing his knowledge into the veterinary world.
And I also remember there's a student, Dr. Tan keep on mentioned, the Charlie's Angel. I think his name is from Dusseldorf. The other doctor, Gui, Dr. Gui, I can pronounce it. Jane Gui. the gentleman that he also are the one of the veterinarian in Europe, and that he also a very big one. And I'm sorry that I wasn't remember his name properly.
Yeah,
Um,
yeah. That's the one that I already said. Is Jean-Yves Gouret.
ah, yes, that's
Jean-Yves
the name.
Gouret.
Jean-E
Gouret. Gouret. Yeah, he is. It sounds like French, but he's German.
Ah, yes, yes. So he is also one of the pioneer like you
Yeah.
together as the perfect the pioneer for the balance method acupuncture. So yeah, thank you. That was the name. Yes,
Okay.
totally
Okay.
come to my head. So Dr. Alfaro, for you from a surgeon to become an acupuncturist, can you tell us something about when you being a surgeon? How did you make the bull look so strong, even they have the testicle
Uh,
cancer?
okay. That's part of the story, right? That
Okay, hold on. I have to say this. All the story that I heard from Dr. Alfaro is at the medical mission. We were driving from the San Jose to the mountain to helping the people, the people who owns the horses, but the jockey, the owner, doesn't have any medical care. The Equine Society, they help all these horses, but they don't have anybody helping the owners. So the medical mission is for me to bring all the students that come with me, go with Dr. Alfaro, we go to the mountain to help those people. So during the driving time, Dr. Alfaro would tell me all the story about he's doing the surgeries for the cow. No, not the cow. Sorry, the bull. So even though they're not really a bold anymore, but they still look very, very tough. They're like the stuff. So let's
so
hear that story, please.
okay. Well, no, that's the story goes like this. Actually, we were talking about why I kept on going to the seminars. I said, well, I want to learn balance method in such a way that I want to have like a surgeon's precision in when I put the needles, because Dr. Tan always says you have to find the right hole, put the needle, so you have to be precise in order to get beautiful results. And we were remembering about some of the surgeries, and then I talk about this bull which was a national champion. Is a Brahman and from Pérez Celedón, that area that we went with the group to do the humanitarian work. And this bull had many offsprings, by artificial insemination and then eventually by embryo transfers, which is semen and stuff like that. So he was very famous, and he developed testicular cancer. His testicles were like the size, each one basically of a American football ball. Uh, it was just painful for him because it was really big. But the owner wanted, to see if there was any solution. I said, well, there's no solution. We have to cut him off. You know. And he said, well, okay, but I need for you to do such a great job that I can eventually, even though people will know that he's castrated and stuff like that, but I can present him and he doesn't lose his pride because he's going to be presented with all of the daughters or offsprings and blah, 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 so that they can get prizes. So we did a great surgery. We did it under general anesthesia at the university with inhalatory anesthesia. So the bull was completely knocked down, and we were able to to have enough tissue from the vessels that and the fibrous tissue that is around it. So we cut the testicles, but we were able to generate like the scrotum. So the scrotum ended up, with God helps, ended up looking very normal. So he actually liked that very much, and I think the bull went to compete like for 2 or 3 more years, something like that. So, but That
So
we were
did
talking about being precise as a surgeon, and then I was saying, well, okay, I want to learn to be precise as an acupuncturist, and so we talk about the bull.
so yes, you were a surgeon and you did a beautiful job. You didn't let the bull lose his pride and
Right.
he represent like he is still a big bull. So
It's
that's
correct.
wonderful for you to being a surgeon of the veterinarian, and now you're doing the acupuncture. And right
Thank you.
now, the surgical procedure is also using the needles. So I don't think you lose any pride for yourself from the surgeon to become an acupuncturist. So I'm still gonna give you
Thank you.
claps for doing a good choice.
Thank you. Thank you.
Excellent. So
Yeah,
now,
no, I don't do surgery anymore, from a long time. I completely devoted myself to balance method basically.
yes,
And now with the new research that has been done in terms of, I was telling Shant, in terms of acupuncture, electroacupuncture in some of the distal points, actually points that we use a lot in the balance method, we know that one of the way that acupuncture heals is by increasing the percentage of stem cells that go into the circulation. So we actually can guide that amount of stem cells to go into different areas to do their job. And that also being studied now and also have been demonstrated. And there's people demonstrating by markers, they they put radioactive material in some of the stem cells so that you can follow them and see where they go, and by magnetic resonance, MRI, functional MRI. So this is incredible advance in terms of how acupuncture works, and we are doing a lot of that, injecting blood into the acupuncture points.
that is so cool. So right now, no, we only have 5 minutes. I
Oh,
want you to share, no further ado, for your case study and the video that you prepare for all the audience about our medical mission trip and also your case study. Maybe we're gonna have a little overtime, but that's okay. So let's go ahead. We have that video, and you can introduce what you prepare for us. Well, the
okay, sure.
wonderful
I'm glad
case
to do that.
study and photos.
Can I share now?
Yes.
Okay. Is it looking good?
Yeah, looking great.
You look great there, right?
Ah,
Okay.
thank you. That's me.
So this is the worldwide healthcare initiative that we have done with Eileen in Costa Rica, and we are very proud of that. We also have done with
Oh,
Dr. Naranjo's help, and we have many Bonnie and Azuko are there, and Lisa, and then we have some of the my students of acupuncture also are here. Omar, you remember, and then you remember Ale, Andrea, Ferris, and
yes,
a whole bunch of people. So we've done approximately, um, according to what I
yeah,
think, you probably have better numbers than I do, but I think we have done in the 3 times that you've been here,
yes.
probably over 600 people
Oh, yeah, easily.
easily, right?
Yeah,
And yeah, and the 2 times that we did horses, so we're probably about 100 horses we have
yeah.
done also with the balance method. Specifically and exclusively, we treat horses for them with balance method, and we treat also a lot of people at the Dr. Naranjo's clinic, and also with the people with crew. This is Lisa Ortuño, which is the representative of this
One,
on ONG, which is called Costa Rican Equine uh, Welfare Group. So this is it's called the crew, Costa Rican group. And so we have here some of the pictures and some of the things I've done. I like a lot to use, like your Yauton 5 and the Shojin 5. I use that a lot. I I've been trying to find out whether I can use Sancha in horses. I cannot, because I don't have the anatomy, but we have been using that in dogs as, and in dogs we know them as Lufen. Lufen are the points used
Yeah.
for Sancha,
Okay.
and now eventually we're gonna see a little bit. This is the case I will eventually present, but this is basically done because of you, right?
Huh.
Because of that area. Uh, so I have here a picture we'll see later, and it's me injecting the balance method acupuncture points with blood after electroacupuncture for the mobilization of the stem cells. So we mobilize the stem cells, we get this blood, and then we find out what the problem of this horse is. We define 1, 2, 3, and eventually when we go to 3, then we inject those points with the stem cell rich and platelet rich blood that
Wow.
that we have increase, we increase it with electroacupuncture up to 313% more stem cells in the blood. It's time dependent, so it's usually by 2 hours we have, at 4 hours we have this amount of stem cells. So this is one incredible way that we have learned how acupuncture, yin yang is working actually through the stem cells and many other transmitters. This is the most uh, recent case of uh, Alicia, which is does a lot of balance. So that you know that we can treat like tetraplegic, paraplegic dogs. They cannot, all of a sudden he cannot walk. He does it very, very badly, like
Oh,
having no way of being able to get up. And this is after one session of acupuncture by balance method, the 12 magical points. By 12 magical points, he's coming from this, in 1 week to this. So we we can explain a little bit more of that, but because of the time, we'll go through that. And this is I'm gonna put this in here for me. This is one horse that we had that had many problems, specifically problems around the hooves that were causing problems on the lumbosacroiliac area because of the abnormality. And so we decided to go ahead and scan him, and you can see that I escaped some of the points because I scanned it before just for the video. But so to show you that when we go to that thoracolumbar area, there is pain, and then when we go to the coxofemoral joint, which is the hip, he's reacting also
yeah.
like trying to fly away. And in this case, uh, I decided, because it's basically Taiyan, yeah, involvement, and also Chaoyan involvement around the hip, to try and use. Well, I've been using it for a while, but what I tried to accomplish because of all these abnormalities uh, was to find some way of putting needles, the least amount of needles that I could balance those areas. And of course, because of the position, right? Because of the position, you cannot basically image Songwan and Mugwan, Gugwan, Songwan, because it's a little anatomical difference. But I took the image from your book and the image from Dr. Tan's book, and basically uh, you can you can use like Mugwan, and you can extend the meridian to the hoof, in which case these 2 points here, we call them in traditional Chinese veterinary medicine, we call them Qiantimen. But to me, these 2 points, you see that immediately
Oh,
after I put that, the animal is not moving anymore. It's absolutely good for diagnosis and good for treatment.
yes.
And hear a little bit of pain, and then all of a sudden, after a few seconds more, then he lowers his head and he said, well, I don't have any more pain there either. So I am also treating, so say I'm treating the head and I'm treating the sacroiliac area, the hip area. And the reason why, okay, the reason why is because uh, Mugwan and Gugwan are basically on the heart and the lung meridian, right? Which will balance the Chaoyan and also will balance the Taiyan. And this is also, this is the area that relates, right? This is the area that relates in the human, in the horse, to this area here in the heel. So you can actually treat locally, but you can treat the neck. And we're going to see why we can do that just in a minute. Let me follow here the faster the video, because I'm in this video I'm also talking and sometimes I talk too much. So let me go a little bit faster in here. But I'm just saying that pericardium 9 here is basically, in the horse, is basically pericardium 7.2 on Dr. Tan, like Chongguan, right?
Yes.
And and okay, so we're gonna hear to the, yeah, go further. And then you have the picture you like, right? Because this is the this is the position that that somebody did this. I don't know who did this, and I apologize because I didn't ask permission. But this I took it from internet, so I thought it was okay to do it. But this is a nice picture, and you can see that if I place this in the horse, on top of the horse, like here, this is Alicia's drawings very nicely. And you can see that this area will image all this one, and it will image this area here too. So that's why it works really good taking care of the neck pain in this animal. And also, if you turn the image to the side and go to the back, then we will also take care of the pain that he was presenting in here. So this is basically one application, right? One use of the Dr. Dong by Master Tan points in the animals that we have extrapolated to there. Okay.
Very nice. Wonderful.
Yeah, and then this is something very fast in the electroacupuncture that is being done at the University of Florida with the Chi Institute, right? And this has been done in 5 species now. So humans, mice, and rats, and horses, and dogs, they all have the same acupuncture points. The points they use are basically then large intestine 11, large intestine 4, spleen 6, and stomach 36. Those points increase by electroacupuncture. They increase the amount of stem cells because they diminish. There is a factor that during the day we don't have stem cells circulating that amount because we're busy. So we need to be asleep so that stem cells come back out of the reservoirs and start doing their job of healing and regenerating our body. Okay, so but by electroacupuncture, we can allow these stem cells through distal acupuncture points to go into the circulation, and then you can take this blood and inject it in different places. So you can do this in yourself in such a way that you also can regenerate yourself because you can do like do 14 to towards do 20. Those points are very important immune points that will increase the stem cells. And then you use large intestine 11, large intestine 4, bilateral in this case. Then those are the main ones that start generating the stem cells. And then you inject it different ways. Okay.
Got it.
So
I
this is.
The student has a question. How
Oh,
often you treat the horses? One time, two times, once a week, or once every month? How often you see the horse?
okay. With
The
balance
basic.
method, yeah, with balance method, we have the opportunity to, uh, to do less treatments most of the time. But like this horse, this is diagnosis. So I am diagnosing, and at the same time, I'm treating. But then I come back, and then I follow my yin yang. Always do that, because that also has been shown uh, scientifically that if you do the balance method, and we have the results, I have the results of those of those research, then you have a better outcome, which is a p-value of 0.01. So this is a statistically significant. There is no way you can say, well, no, it's better. TCVM is better. Uh, it works better. All of them work really good. But when you incorporate the balance method, you have a statistically significant better results. So you tend
Oh,
to have better
wow.
results. So you can combine, you can integrate. You can only do balance method. You can do TCVM plus balance method plus uh, uh, conventional medicine, but you will usually do one treatment for diagnosis and treatment, and then you can back and do once a week for about 5, 6 sessions. Most of the time, that's the amount of time that we spend in treatment. Okay.
Got it. Thank you. I hope that answered the question for you, Ali. Great. And sorry to interrupt you. And go ahead with this one, increasing the P cell level so we can rejuvenate ourselves.
Oh yeah, definitely.
So, yes. So
It,
we
it
can
hasn't it
improve our,
hasn't worked in me that good, but well,
what?
I still active, so that's okay. So I use it in myself when I feel like a little bit down energy and stuff like that. I try to mobilize my stem cells. So when I have like a back pain from my work, because I used to lift up of the legs of the horses all the time, and veterinarians that are listening here, they know small animal surgeons, low back pain, and horse practitioners and bull practitioners also will have a lot of back pain issues. So this is good also to increase the stem cells for that purposes. And okay, well, this is
Have any more photos for
mhm,
the medical missions?
excuse me.
There any more photos after this for the medical missions?
Oh, no, no. Well, but
Oh,
this is
good.
just the human case, but we can escape that if you want to because of the time. And basically, I have a lot of pictures, but I can send them to you
Ah,
from,
thank you.
from the
Well, maybe
from the
you
missions.
can come back to where the treatment is so we can, the human treatment, so you can explain this briefly, please. Oh, this,
Okay,
yeah.
she's a 50-year-old female that has been. I treated her before previously due to right heel pain, and she has a big radiographic view calcaneus spur, and so right heel I image on the left upper arm. I learned that from you, and basically, and that's more recent that I don't recall with Dr. Tan at least during that time, but I think this I got from the last few seminars that I attended, and that's why I always tell people, please keep on going to the seminars, repeat it. I have several students already, veterinarians, repeating the balance method, and I'm already today. I'm gonna register in your next one, and I'm not gonna take the special discount, but I'm gonna do the first one. I'm gonna do the one in China, and I'm gonna do the one in November, the more advanced one. So
December.
I keep on doing that, and I think that's good. You keep on learning. I learned these points from uh, uh, from Eileen, and basically, you look for ashy points around the shoulder, and it took incredible, just one treatment, and the pain disappeared. She was limping, and this is about 2 months without pain, and so now she comes because of chronic insomnia. She complains about diabetes and a little overweight and some heart issues. But her major complaint was acute pain that came um, towards here, towards the lung area, and then went all the way in between the
Wow.
scapula, but towards the uh, low back. So I decided to put. So I said, well, okay, step one is basically tie-in, tie-on. So I I decided to first put these points in here, and around ashy points around long 9, 8, 7, whatever was painful. I put the needles in there, and I think if I diminish this even more, so this is my long 9, 8, 7 ashy points in here, and long 5 in here. And long 5, I usually go deep and then bring it back up, and 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 place it very close to the tendon. Basically, not to treat only thoracolumbar area, but also by treating the tendon. You know how basically Taiyan is full of sinews. Also, it has a lot of fibers in there. So by doing long 5 that way, I am also stimulating the liver, who controls the sinews, so I don't, or the hing, so I don't have to to put many more needles in here. So I went to small intestine on the other area. I basically went first to liver, because liver 8 is so emotional, and I think she was a little bit also upset. So I put liver 8 and liver 3, because liver 3 take cares. Nowadays we know a lot of the frontal lobe, and has to do with depression, and so regulates all that area here, and also putting in here heart 5, because heart 5 has shown nowadays that it's the best point for um, insomnia. So it's heart 5 has been shown compared to a drug that I have written here, which is called Stazolan tablets. And
Really?
you have 39 persons with the Stazolan tablets and 30 persons with heart 5. And it shows statistically significant improvement in the quality and amount and depth of, uh, uh, you know, uh, sleeping, as compared with the drugs themselves. So actually, um, that's why I put the heart 5 there, and I didn't need to put any more. She still have a little bit of problems with insomnia, because she take cares of an adult, so she has to wake up almost every night.
Uh-huh.
And but so I use Ambien 5. Whenever she complains a little bit, I put Ambien 5 and Heart 5, and then I round it up in here with Bladder 65, just at the shoestring point on the area on the left side, which to also help. So I did meridian conversion here,
What?
and shoestring point in here, and this one's for local uh, uh, treatment.
Yes. Got it. Wonderful.
Okay, so
Excellent. Thank you so much for this case study. And I also see that's a very long time to keep it on the screen. I'm sure if you guys want to have it, and you can watch this video again to get those points and get the theories and get the case study. So let's thank
sure.
Dr. Alfaro for all this wonderful presentation of your case study, and
Thank you.
introduce the treating the animal with the balance method to all of us. And I'm
Yeah.
hoping every one of you, if you are interested to go to the medical mission with me, please go on to the whicares.org, whicares.org, to sign up your name. And then we
Yeah.
will send you the information. When are we going to visit Costa Rica again?
Back again. Yes, yes. Soon.
That will be 2021 because right now we still have hard time traveling anywhere,
Yeah.
especially in Canada. So it's not Canada, in California, nobody wants us. Okay, we're still in hot zone. So I wish one day it would be sooner for me to be able to get out and start traveling.
Yeah.
Thank you so much,
We
Dr.
will hope so.
Alfaro.
Sure. Thank you. Thank you, Chant. Thank you, the American, the Academy of Acupuncture, and thank every participant for listening.
Yeah. Thank you.
Wonderful. Bye bye.
Bye bye. Thank you.
Bye bye.
Thank you for joining us. Bye.